How's it feel, Nick?
Feels brand new.
You can throw
Brand
that
new.
hook. Throw that left hook. All right, guys, we're here with Nick. He's just about a year from when his injury happened with the shoulder. So we're just doing our standard treatment, how we keep his shoulder feeling loose, feeling good, even a year post-op. How you feeling today, Nick?
Feeling good, man. It's been great. I mean, I've been training, no pain. I don't even think about it right now. So I can't believe it's been a year. Brings back bad memories. The emotional roller coaster I went through that day. Winning those 2 fights and then having the shoulder pop out. And reflecting on the journey, it's wild to me. It's how much it does affect you. You don't realize it until you actually think about it. It takes time to heal, you know? When I was getting back into training, I'm like, oh man, I feel the shoulder like a little bit like, oh my gosh, like it's never gonna be the same. Like those doubts creep into your mind.
Yeah.
And like 6 weeks after the surgery, I'm like, man, like, am I ever gonna be able to train again, or I have to look elsewhere? Thank God I have this treatment. You know?
Absolutely. So come on and check this out. So we're working, he didn't have any bicep involvement, but I like to just work through, start off the treatment this way, especially because that bicep, that long head tendon's gonna go into the shoulder where he had his labral repair. So as I kind of go through, I'm feeling this feels pretty good. And then I'll even come on the inside. So his pec attachment here, see this big piece of meat? I wanna try to come and get underneath that as I'm working through. And then as I'm coming through, I'm gonna work through the deltoid as well. So this shoulder muscle. And I wanna find his AC joint, his collarbone, where it kind of meets here. I'm gonna palpate, and I'm gonna fall right into this joint space. If this is relaxed, I can get in here a little bit deeper. If I come through here, I can work through, I can get in. It's just gonna be harder on my thumb, it's gonna be harder on my hands. Still wanna work in that position, but because I feel like I can get in a little bit deeper. And he's gonna feel that, but it's okay, we're not gonna spend too much time. So as I work through that bicep that we got underneath, I may even just transition into this pec minor, and I'm gonna really work on trying to get this to open up, and so I can get into this attachment point here, and it's gonna go up and attach to your shoulder. So even if he were to go onto the door and stretch, he's gonna get this pec major. So getting into like an overhead position will get that pec minor, and getting him to
a dead hang.
Yeah, the dead hang, exactly. So because then that's gonna elevate the shoulder complex, and it's gonna pull from where the attachment on the shoulder, even off the table, on how he keeps his shoulder feeling pretty loose. So when
Feels great. Yeah, I mean, definitely a little tender, especially when you get to that pec minor, but yeah, it hurts so good.
I feel like I'm having a hard time, not on him because I've worked on Nick enough times, but I can actually pull his shoulder joint out. So I'm gonna give some space, so it opens up this area. I get a little bit more of a target zone to work into it. This is your subscap muscle. It's a big rotator cuff muscle that is probably the most neglected. Subscap is the one that brings your arm closer to your body. If I open this up, it's gonna allow him to have a better sense of motion up overhead. 3, 2, 1, good. And I'm gonna have you come across, work right through there, and help separate those fibers a little bit more. And good, nice job. If I'm there, I can have him hit me. That hits his end point there, and I'm just kind of stroking through. Last 3, 2, 1. Coming up overhead, and kind of punch through, and I can work like this as well. And good. It's kind of based on how we're feeling that day.
Even then, you adjust to the client. We don't do that often. I mean, even after my surgery, I am a little limited, and that's for a good reason. It's to give me stability. So I don't have full range of motion. You can see I go back further with this arm than I can with this, but you just adjust.
I can start to hit the lat from the front, so I know that it's going to come on the side of the body and come right into the shoulder. This is this meaty part. It's not quite in the armpit, but it's going to come out to the side. And not everyone's lats are this big where you can kind of grab, but for Nick, he works his lats. He's got some good meat. I'll just want to work around his shoulder here, so you can get to like the lower trap. You'll have the middle trap, you'll have the lower trap, some rhomboids. So I'm gonna have him on the side. I can have his shoulder round like forward this way and get everything on stretch. And and I can work a little bit. This is just one position. Now I have a little bit more control of his shoulder and his shoulder blade. I can already start to get my fingers, you'll see my fingernails disappear, so I'm underneath that shoulder. Usually sometimes, man, I gotta work a little bit, so I'll try to prevent that. I'll try to have this come through. And then even this, how like my thumb, look how much that disappears. I can't even see my thumb.
Big lats, huh?
That's it. But like how relaxed this is, usually like, and I know this shoulder is gonna be able to slide and glide on these ribs here just because of that. You have a lot of tension through here, but I like this and I can control, I can use my body. I really have to go, I can try to pull, so then I can get underneath, and then I'm just gonna slide through. And again, we can just work the lat now in this different position here. So I know this is gonna go right into the shoulder.
Don't pull back.
So that's right through here. He got his attachment. It's gonna come around the shoulder and go right into the back, right? Because this is all the way gonna come into all this thoracolumbar fascia here, thoracolumbar fascia. Go into this lower back fascia here.
How you feeling?
That feels so good. Hurts so good.
And open up that way, nice.
Woo!
Come through. Let's just open up this way like you're doing like a band pull apart, and I may just get in and work through it here. You're just getting creative now, right? If you're doing it face down, it might be a little bit different, but I think on the side it's just easier to kind of control and manipulate the arm, especially if the client or the patient is fighting you. 2, 1, good. Just to keep everything loose, that's all. How's it feel, Nick?
Feels brand new.
You can throw
Brand
that
new.
hook, throw that left hook. If you're looking to improve your shoulder health and performance, just click the link below. And we'll see you in the next one.